So I'd like to welcome Dr. Gail Van Norman. Thank you very much for joining me. I'm going to talk about contentious objection in anaesthesia. So my first question is, are you able to explain what you mean about contentious objection in the context of anaesthesia, please?
Certainly. A conscientious objection is literally an objection that's brought about by conscience. It's not an objection to something that you feel a little bit uneasy about. It's not an objection to things that annoy you. It's an objection to something that you feel will so profoundly affect you that it affects your moral identity, that you really don't think you would literally be the same person if you gave in to it, because it affects the very core of what your values are.
Well, thank you. And in the context of anaesthesia, can you give any examples of things that people might object to?
Well, sure. I mean, the common one that people will pick is anesthetists and anesthesiologists who object to providing anesthesia for elective abortions, for example. But those are a little bit less complicated than some of the ones we've run across. For example, a case that I'm going to talk about at the session is an anesthesiologist who converted to Jehovah's Witness church and informed his practice that he would not only not accept transfusions himself, he would not give them to patients even if it would be life-saving to do so.
That's quite the challenge, isn't it?
Yeah.
And where do you think the line should be between the kind of individual's beliefs and the need that we all have to provide efficient and safe care for patients?
Well, I think the simple answer is that for me, it's what we call a moderate approach, which is where physicians and patient care comes first, so that if an objection cannot be honored without harming the patient, we should not honor the objection. We should do whatever's best for the patient. But that in almost all other circumstances, we should do our best to honor and respect our colleagues' diverse beliefs about things. We shouldn't try to establish a common faith or belief in anesthesiology. Rather, we should celebrate the fact that we're all different and we have a different perspective and approach, and that those things should be respected by our colleagues and even supported by them when we can without harming patients.